Hi, my name's Ellie and I'm a lung cancer survivor. I've decided to do a series of videos about my journey through cancer in hopes that I can help someone. Because honestly, it's really, really devastating to get this diagnosis. Even though not a smoker, I still got it. So if you're going through this, I feel for you. It's really, really hard. But I'm also here to give you hope. One of the symptoms that I started with was I had a lot of trouble walking, getting around. I started having to use a cane, and then I graduated to having to use a walker. I remember going to an orthopedic doctor. And actually, I thought that my trouble walking was part of my condition. And then when the doctor said, no, this is not because of your condition. This has nothing to do with it. I'm really, this is not good. I started to take things a little more seriously. Like, okay, maybe I need to pay attention to what my body has been telling me. As this is the second time I've had cancer, some of the symptoms I had when I was a child, as a 10-year-old, going through pediatric ovarian cancer, came up again. So my body had been trying to tell me things like, oh, well, wow, you haven't had this happen since you had cancer as a child. And I was like, oh, no, I'm not going to listen to it. Because really, once you've had cancer, there's always the fear that it's going to come back. I was having other neurological symptoms. I was dropping things. And actually, I ended up buying a stainless steel French press because I broke not one, but 2 glass carafes. So I was like, that's it. I'm buying stainless steel. My fine motor skills just went out the window. Just dropping things, tripping, very, very, very frustrated, especially as a drummer. I couldn't keep a beat. Like, yeah, I know I'm just starting out, but I'm not that bad. I just couldn't get my arms, my limbs, they just weren't working right. And this just got progressively worse throughout the year prior to my diagnosis. Another thing that happened was, and it might seem like a little bit too much, but actually it's an important thing to note. My bowel movements, it changed. It was like my body was trying to rid itself of toxins, really nasty toxins. So I remember that as a symptom from when I was a child. And I took note of that. I said, this hasn't happened since I was a child. So it was another clue. I knew. There was a part of me that knew. Your body is very smart. There is a wisdom to your body. Listen to it. Another thing that happened was I enjoy taking pictures. And my vision started to go. I was having trouble. I'm like, do I need new glasses? I actually made an appointment with an eye doctor. All my levels were, my body chemistry was changing. And that leads me on to another point. I don't use a lot of products with fragrance in it. So I noticed my hair smelled differently, my skin smelled differently. And honestly, I wonder, this is probably how dogs, they can sense it, they can smell it. So that was another thing. And a lot of, gotta sit up straight for this, a lot of women, they'd be like, oh yeah. The girls, they grew. I was like, wow, and, I thought, well, it's just because I'm eating more and, COVID and I'm not exercising enough. And no, it wasn't that. I got to keep the girls though. When I had my blood work done, my hormone levels were off the charts. And that's exactly what the doctor said. Wow, your hormone levels are off the charts. Your estrogen is way too high. Other things, well, the obvious, I started having chest pains. having had a heart attack, I actually thought, oh, it's my heart. Nope, it wasn't my heart. But I didn't know that. I was convinced it was my heart. Actually, before that, I was at the bus stop. And I used to be a martial artist. There's this little boy there, 6 years old. He was just so full of energy. Yeah, I'm taking Taekwondo. I'm like, oh yeah, I'll show you a block and a punch. I can do this. And I couldn't. It shook my whole body just to do it. I mean, it was, wow. Something I'd done hundreds of times before. And then on top of having that happen, having the chest pains when I thought it was my heart, I actually ended up, because the chest pains got so acute one night, that I called 911. And I had them take me over to the hospital, to the ER. Now, on the trip over, it was interesting because I remember telling the paramedic, I haven't felt this bad since I was a child. Because I was feeling overall very, very sick. That's another thing that you will feel awful. Almost like you're fighting a cold or the flu or something. You feel run down, you're tired, you just feel awful. And it didn't just happen to me. I had a lung buddy who helped me through my post-op questions and everything. It was very good support to have. And you can get that through, there's Go To Lung Foundation, and it's a very, very good foundation. I'll leave some of the stuff in the description below. But she was also saying, yeah, a year before I got my diagnosis, I felt horrible. So that's another thing. Anyway, back in June, I was having the chest pains. By the time I got to the ER, my chest pains had dissipated. So I got put to the bottom of the list, which, seeing how crowded it was and being hospitals were still really packed in 2022, I ended up coming home without being seen. But before I came home, they had done a chest x-ray. And I'm so glad that I had that test done, because that gave a baseline. In June, I showed nothing. I was clear. The end of November, beginning of December, I wasn't clear. So, yeah. Sometimes tests might not show something right away, but you get them done a little bit later, and yeah, they might show something. About 1 month before my diagnosis, I started having difficulty. Sorry, there's a dog barking out in the hallway. About 1 month before my diagnosis, I started having problems breathing at night. I didn't just have chest pains. The chest pains were bad. They'd gotten worse. And they were more consistent every night. But I started having problems breathing to the point where I had to prop my head up on pillows, or I couldn't sleep. The other thing, I was having really bad heart palpitations. It felt bad in that it felt like my heart was pounding out of my chest. I was like, okay, what the heck's going on? The other thing that happened was about, my appetite started to decline. It felt like my stomach would blow up like a balloon every time I'd go to eat something. So put a bite in my mouth, and it's like my stomach was saying, nope, not going to accept anything. By a week before, I think it was about a week before, I went into the ER. I couldn't eat anything but soup. That was all I could get in. Homemade chicken soup. That was it. What caused me to call 911 was that I couldn't walk at all without a walker. My apartment's pretty small. It's really pretty small. Yeah, I couldn't walk at all. And I was so scared. I was crawling around my apartment. I called 911. And they ended up, it was so busy at the hospitals, they were like, well, we can take you in, but it's really, really busy. So I said, well, maybe I can see my primary care or something, let's see if this resolves. It didn't. 2 days later, I'm in urgent care, and I was barely able to make it in there. I'm using a walker, just shuffling, even with the walker. And thankfully, the nurse practitioner, she took one look at me and she's like, no, you're going to the hospital. So that saved me, honestly. That saved me. So I hope that, these videos will help you in some way. Maybe you have similar symptoms, or maybe you're starting to have symptoms and wondering. I am not a medical doctor. I will say that very clearly. Please do not take any of this information as medical knowledge. I'm just sharing my experiences. The one thing I will say, as somebody who has gone through the system a bunch of times, unfortunately, I hate it, but if you start feeling sick, don't put it off. Make an appointment with your doctor. First of all, absolutely, get your yearly. Go in and get your yearly physical. Absolutely, 100%. You need that. Don't put that off. Make sure when you go to your doctor, have a list of all of your symptoms written down and when they started. Because when the doctor says, well, so what brings you in here today? You don't want to be trying to remember everything. The other thing is, even if you get a clearing bill of health from the appointment, and they say, oh, you're fine, don't worry, and you still feel really sick, you live with your body 24/7. It's like, I don't know anybody who doesn't. You know your body. If you're still feeling sick, make another appointment. Let them know. If they still give you the all clear, or they say, oh, don't worry about it. If you want to get a second opinion, get a second opinion. There's nothing saying that you can't get a second opinion. And, I'm saying this being insistent because when I was a child, my mom took me into the doctor and I got a clean bill. Oh, it's just baby fat, it's okay. In all fairness, ovarian cancer at the age of 10 is very, very rare. But she knew something wasn't right. So she took me back. My daughter is sick. Something's not right. That second time, yeah, I got taken to the hospital and I got diagnosed. So sometimes, yeah, that's why I say if you're still feeling sick, go back and see the doctor again. This was just the first video in a series I'm going to be doing about my journey. So please come back, visit my channel, like and subscribe. I'll be going through the whole journey from diagnosis to operation, post-op, everything. Hopefully I will be able to answer some of your questions as well and help you out on your journey. This is Ellie saying, take care and stay strong. The food, she noticed it. Something's not right. Well. What am I, Wesley Wabbit? Bugs Bunny? Well, I'm not finding anything. If they say give you a clean, I can't talk. The other thing is, I forgot.